My name is Dr. Jerome Aya-ay. I'm a board-certified family physician. I live in Spartanburg, South Carolina. We have what we call direct primary clinics in Spartanburg, Greenville, Casey, South Carolina, and Mount Pleasant. I realized that there are a lot of pain points in medicine, and entrepreneurship and running a business is really solving problems. You know, where are the pain points in the system that we work in? And one of the pain points was, I can't get an appointment 2 to 3 months out. Number two is, doc, I don't know how much stuff costs. You know, you recommended these medications, you recommended these imaging studies. Patient comes back a month later to go over these lab studies, check on the medications, check if they got their imaging studies. They didn't get it. Why? Because they were scared that it would cost too much, and they had to choose between feeding their family or getting the medicines or the studies that we recommended. My co-founder and I realized that, you know, we can do better. We deconstructed healthcare. So, you know, when you think of the big hospital system, you think of many moving parts: nurses, doctors, admin, techs, respiratory techs, radiology techs, phlebotomists, a lot of moving parts. But in all that, what we used to call noise, we forgot the most important person, and that's the patient. So in our practice, we actually, if you're a member, same day, next day appointments, after hours. After hours, you'll get me. A doctor will actually call you back and talk to you. It's unheard of now. And so, and I think that's, and we've been growing since we started in 2010. So this is our 11th year. We started in Spartanburg, South Carolina, in a 1,600 square foot office building on a $75,000 line of credit. We worked for free for 18 and 24 months. Dr. McCarthy, 18 months, myself, 24 months. At Palmetto Proactive Healthcare, he worked in the ER, I worked in 24-hour urgent care. I mean, we really, just like entrepreneurs, we grinded it out. We don't solve the problems for everybody. You know, Palmetto Proactive Healthcare, it's a membership model, it's direct primary care. We don't contract with insurance companies, Medicare or Medicaid. It's a monthly membership, less than your TV cable bill. It's probably less than your cell phone bill. You get unlimited visits to a physician. We can talk or video chat after hours. We direct you to where there's affordable, low-cost medications, and we also direct you to affordable, low-cost imaging studies if needed. We often like to say our business model is people, and that's the patient. Process, that's direct primary care. We contract directly with the patient, directly with the person paying us. And people, process, and our purpose. Our purpose is to reunite the patient and the physician in a proactive relationship. I think a lot of times in healthcare, what's gone, especially in the big systems, is that relationship. And that's where, if you build a strong relationship with a patient, they start to listen to you, they start to take your advice. But if that patient is jumping from urgent care to the primary care doctor, and then this other urgent care, then go to the ER, the message and getting all the data and looking at it for that one patient gets lost. And it's always a scramble to try to figure out what's going on with that person's health. Every time you go to another venue of care, it just almost resets that button, and the doctor can't figure out what's going on, and we can't get you better. One word to the key of success for an entrepreneur: grounded. I will cheat. Stay grounded. Know, again, your core competency. Know who you are, and build from there. Just like the relationship with the patient, build from that solid relationship. Create that foundation, and then you can put all the bells and whistles in after, but you may not need it.